Hi, ladies and gentlemen. My name is Maynard Eaton with the Southeast Region News. We wanted to just present to you the other side of the story, if you will. I'm sure you would welcome such an opportunity. But this lady's not just another voice in the legislature. She's seasoned 11 years being the premier advocate for health care in the House. A longtime Democrat. This lady knows what she's talking about. Representative Pat Gardner from District 57.
Thank you so much, Maynard. What a great day to be an American. All I can say. I don't know about you, but this morning when I was watching TV, I've absolutely burst into tears. Finally, the Supreme Court has made its determination that the Affordable Care Act is constitutional. I will leave all the constitutional arguments to the lawyers. We're going to hear plenty from them. But no one could be more delighted than I am. As a mother whose baby daughter was denied coverage by an insurance company 35 years ago because she had one of those pre-existing conditions, that was 35 years ago, and it's taken us 35 years plus to actually begin reform our health care law. I'm delighted that no family will have to face the anxiety that my family faced when we couldn't find insurance, no matter how much we were willing to pay for our child. Hardworking families have known for years that the healthcare system is broken. Today, we take a very historic step forward to begin a system of coordination of healthcare. There are 65, actually I read this morning, 85,000 young adults in Georgia who have now been covered by their parents' health insurance coverage. Because this law was not declared unconstitutional, that coverage will continue for those young adults. Small businesses will be able to enroll in a health insurance exchange that will help them provide health insurance for their hardworking working families. Adults will be able to enroll in Medicaid in Georgia, we hope, for the first time. I believe we will save tax dollars. You know, all the mental health treatment in Georgia is paid for almost entirely by state dollars. If those patients who receive mental health services now are able to be eligible for Medicaid, Medicaid will pay for the mental health treatment instead of the state. However, we all know one bill cannot fix a broken system. Unfortunately, one court decision cannot fix a broken system. There are no perfect bills. We in the legislature know that for sure. And the Affordable Care Act, or Obamacare as we're now allowed to call it, will require some tweaking in the next Congress. However, also change brings chaos. And we will need effective leadership in order to implement what we think happened today. We all know health insurance has been complicated. It's going to continue to be complicated. Couple suggestions. I was actually listening to the governor's presentation, and I am here to tell you that the number of dollars, of state dollars that are going to be required to implement the expansion of Medicaid, they have estimated at $76 million. Do you know what kind of revenue that brings to Georgia from the federal government? Over $1 billion. Now, he didn't exactly point it out the same way, but it's important to think about how our hospitals and doctors are going to get paid instead of falling into an uncompensated care category. You know, the choice for us is, for me at least, is easy. Do we spend $76 million in order to get that $1 billion in 2014? We're going to be paying the taxes anyway. So why should we let that $1 billion go to some other state which decides to expand their Medicaid program to include adults? I have a couple of requests for the governor. I think he probably knows already what they are. I'm delighted that he talked about suspending but not ending the Health Insurance Exchange Commission, which was set up to establish a health insurance exchange in Georgia. The business community that were on that committee, which I served on, probably the only Democrat on the committee, well, except for an advocate here. I don't know if you're a Democrat, but you know, I forgot to point out, it's a thrill to me to be backed up by the healthcare advocates in our state. I think most of you know most of them, but we have doctors, we have our premier researcher on health insurance. It's just a joy to be able to know that there are lots of advocates in Georgia who support the position. And I guess my request to the governor is simple. Please look carefully at how we can expand the Medicaid program to cover adults. I believe we can do it. I think the savings will be important over the longer term. It might be a shock at the beginning, but we have a shock every year with regard to the Medicaid program. I also believe that the health insurance exchange is an important part of what we need to do going forward. I believe that we will be able to work with the governor on trying to come up with a way of doing that so that small businesses can get their insurance for their working families. He used the word suspended. That made me happy. So I make these couple pleas to the governor. As you know, I will make it personally to him, and I look forward to working with all of you and with the governor in the future on this issue. I have a couple of other people who would just like to make a quick statement or two, and then we'll answer some questions. Cindy Zeldin of Georgians for a Healthy Future.
What a great day for Georgia healthcare consumers. Today we are excited to be here for this truly historic day. No longer will Georgia consumers be told that they are denied health insurance because they have a pre-existing condition. Now we'll work together with policymakers, stakeholders, everyone moving in the same direction. We want to put politics behind us, leave the uncertainty behind, and build a system that really works to make sure that all Georgians have access to quality, affordable health insurance. We have nearly 2 million uninsured here in Georgia today. We have many consumers who do have health insurance but don't have adequate consumer protections within their health insurance plans. We have doctors and hospitals that are dealing with uncompensated care. These are problems that we can solve together as we move forward now that we have this framework of the Affordable Care Act and the promise of really a healthier state and a healthier population and hopefully a better economy as well as a result. So thanks to you all for being here, and thanks to Representative Gardner for her enduring leadership on this issue. She's truly a champion in the legislature, and we are all really, really lucky to have an advocate in any way and to help however I can to move this forward. Thank you.
Thank you, Cindy. Georgia Watch is an organization we're going to count on to make sure that the implementation of this bill goes well. So I've asked Elena Parent, who technically is still a colleague of mine, but is also the executive director of Georgia Watch. Elena? It's a great day.
Thank you so much, Pat, and let me echo Cindy's words about Pat is really our expert on healthcare, and her advocacy has made such a difference for millions of Georgians. And we at Georgia Watch, and also myself personally as a state representative, am absolutely thrilled today with this decision. We now have the ability to cover millions of uninsured Georgians. We are thrilled that insurance companies won't be able to deny coverage based on pre-existing conditions. We are thrilled that those who can't afford it will be able to be given help to buy health care insurance today. And we really look forward to working with our partners, working with Representative Gardner and other state leaders to ensure effective implementation both of the Medicaid expansion and of the healthcare exchanges, which will provide a fabulous framework for a public-private partnership to move forward to ensuring millions of uninsured Georgians who, until today, have had vastly more limited options. So this is a great day for Georgia consumers. It's a great day for all Georgians.
Dr. Harry Hyman from Morehouse Medical School.
Yeah.
Good afternoon. Clearly a historic day for all Georgians, and a particularly historic day for the 1 in 5 Georgians who are currently on the outside of the system looking out. 1 in 5 Georgians is currently uninsured, and the Supreme Court decision today helps secure a pathway for them to get insurance, to get inside, and to get the care they need. But let me tell you what the face of these numbers looks like through the eyes of a physician. These are the patients that come to us with chronic kidney disease, or after a stroke, or after a heart attack, because their chronic condition wasn't treated because they didn't have access to care. These are the patients that my colleagues here see in the Grady Emergency Department for the crisis that could have been managed inexpensively with a good outcome in an office, but now ends up being a hospital visit. These are the patients in our state that die prematurely for diseases that we could manage simply and efficiently if they had an entrance ramp to the healthcare system. So this is really historic because what it does is provides the groups that have been sitting outside the system an entrance ramp to get in. So those who are low income, which disproportionately are people of color that experience the worst health disparities in this country, make up 30% of our population, but 50% of those who are uninsured. And we know that those who are uninsured are 6 to 7 times less likely to see a physician when they're sick, less likely to follow up for chronic care. And it also means in our rural communities, people that don't currently have access to care. So this is truly a historic day for us to not look back at the broken system that we've been trying to fix, but to look forward, and to not look back to the political rhetoric that we've been tied up in since this law was passed, but to look forward to the system change that we all need to build a better system for all Georgians. Thank you.
People like me and Dr. Hyman who've been working in the trenches for more than 20 years and had discouraging experience after experience to finally have what will at least set us on a new path. I wonder what's on your mind. We would certainly entertain any questions that you have. Anybody got any questions, or have we told you everything you wanted to know?
Well, can you talk a little bit about the Medicaid expansion, and if the legislature comes back next year, if the governor or the legislature come back next legislative session and they don't want to expand or they don't put it in the budget, what kind of options are there then? What would happen?
Well, I can't tell you. I will tell you that we know already there is a $300 million shortfall in next year's, or actually in the upcoming year's budget for Medicaid. We know the policymakers were all worried about that. It is also true that they sometimes borrow money from the state health benefit plan and Medicaid to pump up other parts of the budget. So it is my belief that this governor will look hard to see whether this is affordable. I really believe that he will make an effort because he knows people in our state are suffering. If you think about no adults being covered by Medicaid in Georgia compared to other states which cover much more freely, it's time for Georgia to take a look at those folks who are ending up in the emergency rooms and costing us enormous dollars.
But they keep, I've talked to some lawmakers today, and they say that $2 to $2.5 billion obligation over the next 10 years is not going to be affordable for the state moving forward.
Well, you know, in their numbers, that brings $40 billion of federal funds to our hospitals and our doctors. Do we not want that $40 billion? We're probably gonna pay for it anyway as taxpayers. So wouldn't you just as soon have some of it come to Georgia instead of all of it going to New York?
You seen any concerns? One of the, I forget where I read this today, but one of the reports talked about the issue of what happens when some states opt into this and some don't. When you talk about competition for jobs and business between states, the states that don't participate could be somehow at a disadvantage.
I hope that Georgia will begin to look forward. I think having health insurance available, a healthy population is key to economic development. I mean, if you only looked at children, I mean, how can children go to school if they're sick? We need to make sure that we have a healthy population to have a healthy workforce.
Can you explain how far along the state is in developing the exchanges?
I can tell you how
That's
far
easy.
I think they are. I will say this about my experience on the exchange committee, and that was that the business folks on that committee said, we need to do this no matter what. We need to help small businesses. The number one complaint of small businesses is that they can't afford health insurance for their workers, and they would like to. So we need to make it easier for them, and I believe the exchange will do that.
Well, so based on those task force, the task force that was in place last year, what needs to happen from here until what? There's a November deadline for it?
I mean, I will leave the leadership to the governor and work with him on that. I did introduce a bill, House Bill 801, which I believe was sort of the structure that we came up with, that nobody really disagreed with too much. If we can get it out of the politics, now that this particular piece is settled, I think we can start talking about what's best for the state instead of what's good. I mean, we'll wait till after November, there's no question about that. But when Obama wins in November, it's going to be a new day for Georgia.
Sure. I just wanted to say something quickly about the exchange, and that many of you may know this, but there is a federally facilitated exchange that the U.S. Department of Health and Human Services is working on right now. So we encourage the state to move forward with an exchange, but whatever the state decides to do, consumers will have access to an exchange, and they will have access to health insurance in 2014, whether it's through the federal exchange or the state exchange. It's great if we can do it here and have it really work with the Medicaid program closely, but either way, consumers are not going to be left in the cold, and that's something to celebrate.
Not the first choice of Georgia policymakers.
What is your advice for Georgians to get good information and to try to understand something that's complicated?
Well, that's a good question. There are going to be all kinds of, there are some very, very well-educated reporters in this room that I'm counting on to help me understand. Georgia Health News, I know for one, is one of the places I go to learn things. I go to Georgians for Healthy Future. I also go to the Georgia Budget and Policy Institute. It's gbpi.org. And you know, we're all going to have to do a little research because healthcare has gotten so fragmented and it is so complicated. We've put Band-Aids on for 50 years, but hopefully we will be moving toward a comprehensive, collaborative system. It doesn't answer your question, but I don't think I have an answer.
One last question.
One last. Anybody else? Thanks so much for being here. Really.
Not anyway.